So if you're looking to have an appointment at Geniuslane, this is an information video. So I am the founder for Geniuslane, and this is a child neurology and neurodevelopmental organization. So we look after children from the age of 0 to 19. And if a child has any neurological problem or a neurodevelopmental problem, we use guidance from NICE UK. And these guidance are evidence-based guidance. So there are lots of doctors associated and working with Geniuslane. All of these doctors are trained to take a neurological, a neurodevelopmental, or a neurodiverse history. So they are given performance and they are given training as well as constant supervision. So very important for us to get that information thoroughly through doctors. We don't use online performers, we use proper trained people to get this information. Based on the information and based on what we find on our neurological examination, so we look at the child, we look at how their head has grown, what's happening with their eyes, how is their tone, how they talk, how they interact, any other medical problem, heart, liver, kidney, and we combine them together. We also specialize in looking at children's behavior, whether they are showing any difficulty with their social interaction or social communication, or they are displaying any restricted repetitive behavior. So my team is able to mark them, and then we combine together to create a profile or diagnosis. At this stage, they might be able to request for some appointments for more investigation. So they might do some blood test, they might do an MRI, they might do some genetic test, they might ask for more specialized test. But we do not do all the testing in every child. We are very, very careful, and we only test based on what we have found. Once we have reached this stage, we are able to give you a diagnosis, which is like a doorway. So diagnosis will tell you, okay, why the child has problem, what to expect, and how you should take things forward, what to avoid, what treatment to give, what medicine to give. So we use the latest evidence. After appointment with Geniuslane, my expectation is that you have a clarity of why, what, and how. Means why this problem happened, what is it called, and how do you carry forward and get more information and more help for your child. When I started Geniuslane, I found that lots and lots of parents were unclear about the child's problem, and they were focused on their difficulties. The child is not talking, child is not walking, or child has seizures, but they did not understand why. In that case, I have seen them trying a lot of different things, going to a lot of different places, which has actually caused more harm to children. So one of my very important aim in this is to prevent harm in children. So I've created an app. So every child who comes to Geniuslane, they will be asked to download my app so that they can see the video of the diagnosis, which is very child-centered, simple to understand, and prevents you from going into the wrong trap, which is the big internet market, which is open to exploit you. So this resource is available. You can use it for yourself, share with other people, and we keep on updating it. The other thing is, once you have downloaded the app, seen the doctor, you got the diagnosis, all of your things can be discussed with me or with other world experts, so you get the right diagnosis and the best treatment available to date. So our aim is to prevent harm in your child's life, is that they achieve the best outcome. And if they have something for which they need early intervention, we have a whole process of early intervention, which I have discussed in the other video. I wish you all the best, and if you do decide to take a consultation with us, please be rest assured that you'll be getting highly qualified professionals and the best international treatment available. Thank you.